Grinding and clenching of the teeth usually occurs at night while we sleep, and most of us are not even aware of it. Unless someone sleeping near us complains of being annoyed by the noise of the grinding. However, this can also be a daytime habit. In many cases, it is. Bruxism is a very common problem. It's estimated that about 10% of adults and approximately 15% of children are affected. Your dentist is usually the one to recognize the damage caused to your teeth and to raise awareness. For those of us who experience moderate to severe bruxism, an occlusal guard can be of great benefit to our oral health. It is also very important to keep your occlusal guard clean, so please thoroughly clean them before and after each use, as they're prone to collect bacteria and other microorganisms. Not giving your occlusal guard the proper care can not only lead to other oral health issues, it can also spread other diseases. Also, you have the hard occlusal guard. These are used for severe or extreme cases of bruxism. They're made of acrylic. They're quite durable. Yeah, they last a long, long time. These will need to be made custom fit by your dentist. Do you really need a night guard or occlusal guard? Some of you may be wondering, do I really need an occlusal guard, otherwise known as a night guard? Well, occasional tooth grinding or clenching should not be cause of concern. Long-term bruxism can cause severe problems such as pain, loss of tooth enamel, tooth sensitivity, broken teeth, and in severe cases, loss of teeth. Do you really need an occlusal guard or night guard? Some of you may be wondering, do I really need an occlusal guard, or otherwise known as night guard, while occasional tooth grinding or clenching should not be cause of concern? Long-term bruxism can cause pain, loss of tooth enamel, tooth sensitivity, broken teeth, and in severe cases, loss of teeth. Tooth grinding or clenching usually occurs at night while we sleep, and most of us are not even aware of it, unless someone sleeping near us complains of being annoyed by the noise. But it can also be a daytime habit. Yeah, bruxism is a very common problem. It's estimated that about 10% of adults and approximately 15% of children are affected. Your dentist is usually the one to recognize the damage caused to your teeth and to raise awareness. For those of us with moderate to severe bruxism, an occlusal guard can be a great benefit to our oral health. Okay guys, so some of the symptoms that may indicate that you might need an occlusal guard are, of course, grinding and clenching of the teeth, temperature sensitivity. Your teeth may become sensitive to hot and or cold, jaw pain and or stiffness, facial pain, tooth mobility. Your teeth may become loose, disrupted sleep, worn down and fractured teeth, and dental restorations, morning toothaches, headaches, earaches, and of course there may be someone who sleeps near you who's complaining of the noise. It is also very important to keep your occlusal guard clean. So please, thoroughly clean your occlusal guard before and after each use, as they're prone to collect bacteria and other microorganisms. Not giving your occlusal guard the proper care can not only lead to greater oral health issues, it can also spread other diseases. Then there's the dual laminate occlusal guard. These we make for moderate to severe teeth grinders. The outer layer is hard and durable, but the inner lining is soft and comfortable. So there are different types of night guards available. Then there are the three most common types of night guards available, used to limit the effects of bruxism. We do, however, recommend that you speak to your dentist if you have any questions regarding which type of occlusal guard is most suitable for you. They should be able to advise you. So let's talk about the different types of night guards available. First off, we have the soft night guard, which is used to alleviate symptoms for mild cases of bruxism. They're usually very easy to grow accustomed to wearing and should fit comfortably. What is an occlusal guard? The term occlusal refers to the chewing surface of your teeth. If you're causing damage to the occlusal surface of your teeth, your dentist may recommend an occlusal guard. An occlusal guard is otherwise known as a night guard, a bite splint, however you refer to it. It is a removable appliance which fits over your upper or lower teeth. This is used to prevent damage caused to your teeth by clenching or grinding, which are destructive habits known as bruxism. An occlusal guard is an appliance similar to a sports mouth guard, except less bulky and are made of thinner, smoother plastic. Occlusal guards are custom made to fit your mouth exactly and are much more comfortable than those you might purchase at your neighborhood drugstore, or those that you might purchase online, where you have to boil or microwave and bite. The fit is never the same as if it were custom made at the dental office. Now, if under the advice of your dentist you do decide to use a night guard, he or she can also advise you on which type would be most suitable for you. This will all be depending upon the severity of your case and an individual's comfort, as well as limited finances. Now, the occlusal guard doesn't necessarily stop us from clenching or grinding, but it does protect the tooth surface from damage. The night guard can also alleviate symptoms associated with bruxism, such as sore jaw muscles, jaw pain, head and neck pain, wearing and fracturing of the teeth, tooth sensitivity, and headaches. Certainly, your dentist's recommendation of a night guard is very well intended. Of course, the intention and the goal is to reduce the symptoms and risks brought on by bruxism. However, if you feel any kind of discomfort with your night guard, please be sure to notify your dentist. He or she may need to make some adjustments, and we'll see to it that you get the right fit. An occlusal guard is an appliance similar to the sports mouth guards. except they're less bulky, usually less bulky, and made of thinner, smoother plastic. They're custom made at the dental office so that they fit your mouth exactly. Unlike those that you buy at your neighborhood pharmacy, where you have to boil or microwave and bite. Same thing with those you can purchase online. And the fit is never the same as if you had it custom made within the dental practice. If you have any questions regarding whether you may need an occlusal guard, it is advisable to see your dentist for a thorough evaluation. He or she can inform you if you have had or could have any damage caused to your teeth by bruxism. And although an occlusal guard won't stop you from clenching or grinding, it will be quite an effective way of protecting your teeth day and night if you suffer from these disruptive, unconscious oral habits. Okay, so some symptoms that may indicate that you may need a occlusal guard, of course, would include clenching and grinding of the teeth, temperature sensitivity. Your teeth may be sensitive to hot and or cold, jaw pain and stiffness, facial pain, disrupted sleep, mobility, tooth mobility. Your teeth may become loose. Also, worn and fractured teeth and dental restorations. Morning toothaches, earaches, headaches, and of course, someone who may sleep near you who is complaining of the noise.